It's a spring morning near the Alps, around 3300 BC. Your foot is bleeding, and you're a hunter high on a mountain pass. An arrow is buried in your shoulder, and no pill sits in your pocket. There will be no pharmacy, no drugstore, no clinic for another 5,000 years. But there is pain, bright and screaming, exactly the same pain you'd feel today. Your nervous system hasn't changed, so you kneel beside a cold mountain stream. You reach into a pouch and pull out a fistful of tree bark. You start to chew, bitter, awful, like gnawing on damp wood. And slowly, strangely, the throbbing in your shoulder begins to dull. You don't know why. You just know that the bark works. That hunter was real, and we actually found his frozen body. And that bitter bark he was chewing on? It was basically raw, natural aspirin. Every muscle in your body wants this pain to stop right now. And that this right here is where our real story of ancient pain truly begins. So here's the question that should honestly keep you up at night. How did ancient humans handle pain? Not the little stuff, the real stuff. A shattered leg. A rotting abscessed tooth. A hard childbirth. A deep infected wound. A world with no antibiotics, no anesthesia, no ibuprofen at all. Every ache you've silenced with a cheap bottle, they faced completely raw. And here's the strange part. They didn't just grit their teeth and endure. Humans survived countless broken bones and abscessed teeth and torn open flesh. Long enough, somehow, across 10,000 cold generations, to eventually become you today. Pain isn't just unpleasant, untreated, it can genuinely kill you. It drops you into shock, stops you eating, sleeping, hunting, and healing. A species that couldn't manage pain simply would not be here. So they managed it. The only real question is how. And the answer is far weirder than they were just tough. Imagine setting a broken thigh bone with only your two bare hands. No numbing, no stitches, no clean water, no second chances. For nearly all of human history, that was simply normal. Here's the thing nobody tells you. It was never one single trick. It was a whole hidden toolkit built over thousands of years. Built by trial, by error, and by a lot of very brave guessing. Bark that became aspirin. Plants that switched the brain off. Skull surgery with a stone, and a stranger fix saved for the end. One painkiller that was inside them the whole time and inside you now. Stay with me. We'll climb from clever to genuinely astonishing. Let's go. By the end, you'll never look at a pill the same way. Each layer is stranger and smarter than the one before it. Start with that bark, the oldest painkiller you can still buy today. The tree was the common willow, growing quietly along riverbanks all over the world. Ancient people were unknowingly dosing themselves with the active ingredient in aspirin. The Aber's Papyrus, an Egyptian scroll from about 1550 BC, lists willow. It recommended willow for swelling, for inflammation, and for stubborn, throbbing, everyday aches. The Berlin Papyrus prescribed that same willow for a sore tooth. Around 400 BC, Hippocrates told Greeks to chew willow leaf and bark. He prescribed it for fever and for the sharp agony of childbirth. Different continents, different centuries, the same tree, and the same idea. That's not coincidence. It's humans everywhere noticing one quiet miracle. Willow bark contains a compound called salicin, which your gut transforms. It becomes salicylic acid, the direct chemical grandparent of your aspirin. Chemists only isolated salicin in 1828, thousands of years too late. Bayer only trademarked aspirin at the very end of the 1890s. So ancient humans beat the modern laboratory by roughly 3,000 whole years. They skipped the beakers and the test tubes and walked straight to the riverbank. Picture a pharmacy that grows by the water, open all night, no copay. The catch? It tastes like gnawing a damp wooden fence post. And you have no real idea what dose you're actually getting. But it worked because the chemistry was real, not magic, chemistry. These people were running the slowest, biggest drug trial in history. Millions of humans, thousands of years, one bitter mouthful at a time. Bark only takes the edge off. It can't switch the pain off. So what did you do when you needed the lights to go out? Salix is the willow's Latin name, and salicin hides inside it. A mother in labor could chew it to soften the pain. You've almost certainly swallowed its descendant this very year. The Sumerians and Assyrians left willow remedies on clay tablets, too. Long before Greece, clay tablets in Mesopotamia already praised the willow's power. One humble tree, chewed and ground into medicine, across a dozen separate cultures. Nature had written the recipe long before we could read it. Meet the plant they literally called joy, the opium poppy. 6,000 years ago in Mesopotamia, people deliberately grew this poppy. Some Sumerian texts mark it with a sign read as joy plant. Honest historians admit that translation is still argued over today, but the real point underneath it isn't in any serious doubt at all. Humans found a plant that reaches in and lowers the volume of pain. Opium's molecules happen to fit the brain's own locks, its natural opioid receptors. The very same receptors your body uses for pain and pleasure. By the Ebers Papyrus era, Egyptians folded poppy into their remedies. Juglets from a New Kingdom tomb tested positive for opium residue. That's not legend in a dusty book, it's chemistry in a clay jar. And the poppy kept darker company, like mandrake and henbane. Mandrake root was tucked away, of all strange places, inside Tutankhamun's golden tomb. Henbane was so potent, one formula blended it with opium for the head. These true sedatives could dull a screaming patient enough to work. A healer could set a snapped bone or pull a rotten tooth. But here's the honest, chilling downside. This is genuinely deadly medicine. The gap between comfortably numb and never waking up was a guess, made by firelight, by feel, with no measuring spoon and no antidote. Get the dose wrong, and the painkiller became the cause of death. Think of a dimmer switch wired straight into the human brain. Except the dial has no numbers and the electrician trained on the job. And still it worked often enough to spread across the ancient world. From Iraq to Egypt to Greece, one flower kept turning up. When the Greeks needed a god of sleep, they crowned him with poppies. An entire civilization pointing and saying, "This makes the hurting stop." Bark and poppy work from the inside. Other tricks came from outside. A skilled healer learned the correct dose the only way possible. Watching, remembering, and passing the knowledge quietly down the line. Too little did nothing. Too much stopped the breathing forever. Respect the poppy, because the poppy does not forgive mistakes. For a patient in agony, that single flower was pure mercy. A careful pinch could ease a birth, a wound, or a raging fever. Try this now. Grip an ice cube until your fingertips go numb. Ancient humans cracked numbing too, high up in the Andes Mountains. Their tool was the coca leaf, chewed for a very long time. In northern Chile, mummies preserve a 3,000-year record of chewing. Evidence from Peru may push leaf use back some 8,000 years. They had stumbled onto a real, natural local anesthetic from a leaf. It's the same chemistry your dentist injects to numb your gum. Pack a wad against your cheek, and the flesh goes quietly dead. The active compound is the ancestor of the whole cane family. Andean healers leaned on coca during their difficult skull surgeries. They may have let coca-rich saliva drip into the open wound. Imagine numbing gel, except it's a leaf that also helps you climb. And coca was really just one clever outside-in trick among a great many others. Humans everywhere reached for the oldest thermostat: simple heat and cold. A cold running stream to numb and quiet a swollen, aching, throbbing joint. And cold's brutal cousin, cauterization, pressing red-hot metal to a wound. It sealed the wound and drowned one pain under a bigger, briefer one. Scientists still study that logic, and they call it counter-irritation. A fresh, sharp signal can crowd a deep, grinding ache out of mind. It's exactly why you instinctively grab and rub a stubbed toe. The ancient version was simply a great deal more committed. But what if the pain is locked deep inside the skull itself? A hard day's climb, and the leaf keeps you moving forward. The Inca later called coca a sacred gift from the gods. Chew, tuck, and wait as the sharp ache slowly fades to numb. Heat, cold, and pressure were medicine long before any pill existed. Your heating pad and your ice pack are both truly ancient inventions. Now it tips into the almost unbelievable side of ancient medicine. Ancient humans drilled holes into living skulls, entirely on purpose. And the wide-awake patients got up and actually walked away from it afterward. It's called trepanation, and it may well be the oldest surgery on Earth. We have trepanned skulls from 7 to 10,000 years ago. They turn up across Europe, Asia, and above all in Peru. Here's the proof it worked. The bone around the hole grew back. Smooth new bone only forms if the person lived on for months. So this wasn't carving on the dead. These were living, breathing patients. They were wide awake, and remarkably, many of them survived. In the Neolithic, roughly 4 in 10 pulled through the operation. But ancient Peruvian surgeons pushed survival toward 80%. 80% with only stone blades, no anesthetic drip, and no antibiotics whatsoever. In the American Civil War, skull surgery killed over half its patients. So Andean healers were outperforming 19th century doctors with metal saws. Why open a head at all? Often to relieve pressure and pain. A shattered piece of bone could press down on the brain. Lift it out, and you could end headaches and stop seizures. Think of it as the most terrifying pressure release valve anyone has ever invented. Operated with a sharpened stone and a very steady pair of hands. And no, for the record, I would not have volunteered first. Those healed skulls prove these people were doing real anatomy. Planned, physical, skilled surgery aimed squarely at ending pain. What if the treatment wasn't a blade, but a needle and soot? Some skulls even show 2 or 3 separate healed holes. That means the same person survived surgery more than once. The surgeon scraped, never punching straight through the fragile brain. Slow, careful, and patient, like sanding gently through a wall. Surviving that, then healing, is nothing short of astonishing. Generation after generation, these surgeons quietly refined a genuinely terrifying craft. Remember that hunter on the mountain pass? We have his body. His name is Otzi, a man frozen into an alpine glacier. He is 5,300 years old, and hikers found him in 1991. And his skin is wearing a genuine, unsolved mystery. Otzi carries 61 separate tattoos across his weathered body. They may be one of the oldest pain treatments ever preserved. These marks aren't decorative. No animals, no symbols, no art. They are plain lines and little crosses arranged in clusters. They gather exactly where an overworked body screams in protest. Right on his lower back, his knees, his ankles, and both of his wrists. Points of strain and points of the arthritis x-rays confirm he had. The tattoos were cut into the skin, then packed with charcoal. And here's the part that raises the hair on your arms. Many sit right on classical acupuncture points on the body. That's roughly 2,000 years before acupuncture appears in Asia. Picture a modern heat patch you slap on a sore back. Now imagine it inked into skin with soot 5,000 years early. We can't ask Otzi whether it truly took the edge off. But the placement is far too precise to be mere coincidence. Somebody was reading this man's pain and mapping it onto him. This was personal medicine, tailored to one aching body on a mountain. Every fix so far has been a thing that you can hold. But the most powerful painkiller wasn't a thing. It was each other. Careful multispectral imaging in 2015 finally counted every one of the 61 marks. He also carried medicinal fungus, useful against nasty gut parasites. Someone cared enough to treat him, mark by careful mark. His body is the most studied ancient human ever found. Every scan turns his frozen skin into a 5,000-year-old medical chart. Travel back 45,000 years to a cave in northern Iraq. The place is called Shanidar Cave, tucked deep into the rugged Zagros Mountains. Inside, archaeologists found a Neanderthal man we call Shanidar I. His skeleton reads like a whole catalog of terrible disaster. He is our finest evidence that care itself is a painkiller. He had a withered right arm, likely amputated at the elbow. He was probably blind in one eye from a crushing head blow. The damage even hints that he may have been deaf. In a hunting world, any one of those meant a death sentence. And yet his bones show he lived on for many years. Somehow he reached genuine old age for a battered Neanderthal man. Sit with what that survival actually requires from a group. Somebody brought this man food, guarded him, and simply stayed near. You don't survive one-armed and half-blind through Ice Age winters alone. Not unless a whole group decides you are worth keeping alive. That's a community deciding, together, that your pain truly matters. And modern medicine has finally caught up to that ancient instinct. Being cared for and gently touched measurably lowers your pain. It calms the body's stress response when trusted people are near. Loneliness sharpens pain, while belonging quietly blunts and softens it. The people of Shanidar never read that study. They simply lived it. They simply did it, 45,000 years ahead of any medical schedule. And that sets up the strangest painkiller of them all. A later study of his ear even suggests serious hearing loss. Feeding a hunter who cannot hunt is a daily, deliberate choice. Touch releases oxytocin, which quietly dials your pain down. Compassion, it turns out, is very old technology indeed. Now let's be honest with each other for a minute. It's tempting to think ancient people had it all figured out. Noble, stoic geniuses who somehow just quietly felt no pain at all. They didn't, on both counts, and the myth is worth killing. The biggest myth is that they were simply tougher than you. That's flat wrong. Their nervous systems were identical to yours. A Neolithic toothache hurt exactly as much as your worst one. They just had far fewer ways out of the hurt. And our image of their anesthesia is mostly a comforting fantasy. Picture biting a leather strap and gulping strong liquor before surgery. Honestly, alcohol is a genuinely lousy anesthetic for real pain. To numb it, you'd drink yourself toward outright alcohol poisoning. For most of history, there was no clean off switch for agony. Many people simply hurt, through the bone setting, through the birth. Honoring how they coped means admitting coping was often all they had, which makes the final discovery all the more astonishing. The strongest medicine on the whole list was never a plant. Some so-called cures were useless or quietly made things worse. So here's the twist that reframes this entire story. The most powerful painkiller of all wasn't out in the ground at all. It was in the patient. Your body makes its own opioids. When you're hurt, your nervous system can flood itself with endorphins. The word endorphin literally means the morphine within you. They dock onto the very same receptors as poppy opium. That's the runner's high, quietly muffling pain from deep inside you. A soldier can be wounded and feel almost nothing until later. And here's the staggering part that ties the whole story together, and that inner pharmacy can be unlocked by expectation and belief alone. In 1978, researchers gave patients a fake painkiller, a placebo. It worked, and their very real pain genuinely dropped away. Then they gave a drug that blocks the body's own opioids. And just like that, all of the pain relief completely vanished. Read that again, because it genuinely rewires how you see this. The placebo was releasing the body's own natural opioids. The comfort was fake, but the chemistry was absolutely real. And that's not a metaphor. That's your brain making a real drug. Now look back at the whole ancient toolkit through that lens. The shaman's chant, the ritual, the healer's confident, steady hands, the tattoo pressed into aching skin. We called these fake cures. But belief and ceremony can trip the switch for your own morphine. The ritual wasn't just decoration wrapped around the real medicine. Sometimes the ritual quietly was the medicine all along. The oldest, deepest painkiller on Earth was never actually a plant. It was belief, and the body brews the drug to match. This is called placebo analgesia, and it is thoroughly documented. Your expectation alone can reshape what your body actually feels. The confident healer wasn't lying. Belief was part of the cure. Hope, it turns out, has a real chemical address inside you. Your beliefs quietly reach down and help rewrite your own body chemistry. So come back to you right now, in a warm, quiet room. A bottle of painkillers is probably within easy arm's reach. That ordinary little bottle is barely a single century old, remember. Everything before it was the willow, the poppy, the coca leaf. The drilled skull, the inked back, the friend who simply stayed. 100,000 years of humans refusing to just lie down and hurt. The same body that carried them is carrying you right now. The same endorphins, the same nervous system that screams and soothes when you rub a bruise or breathe slowly through a wave of pain. Or reach for a hand in a quiet hospital hallway. You aren't being modern. You're doing the oldest human thing there is. Pain was never really the enemy that finally beat us down. It was the problem we solved together, over and over again. One bitter mouthful, one steady hand, one act of care at a time. You carry 10,000 ancestors of survival inside your skin. And you are still, right now, part of that unbroken chain.